Good afternoon and welcome to today's webinar, COVID-19 Innovations in Nutrition Programs to Address Food Insecurity, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session towards the end of today's event. Your moderator for today's webinar is Kayleen Claridge. Kayleen is the Marketing and Membership Manager here at the Network's National Office, and she'll be leading us through the rest of today's webinar. So Kayleen, over to you.
Thank you, Charles. At this time, I'd like to introduce our speaker. Matthew R. Swinburne is Associate Director of the Network's Eastern Region Office. He is a graduate of the University of Maryland Francis King Carey School of Law. Matthew has 10 years of experience in public health law and policy and served as a law and policy analyst at the Center for Health and Homeland Security before joining the network. His current work focuses on issues of food safety and security, injury prevention, chronic disease, environmental health, and cannabis policy. With that, I'll turn it over to you, Matthew.
Hello, everyone. Thank you for taking the time to join us today to talk about the challenge of food insecurity during the COVID-19 pandemic. Today, I am going to kind of do a survey of some important government programs that are trying to address this challenge. But I think we need to talk a little bit about the scope and magnitude of the problem or the public health challenge that we're dealing with. The USDA every year publishes a report that looks at the number of Americans who are food insecure, meaning they don't have enough food to live healthy, active lives. And last year's report indicated that 37.2 million Americans were food insecure. Now, this public health challenge is not unique. Like most public health issues, there are horrible disparities in terms of the communities that are impacted. And as you'll see, white Americans experience food insecurity at around 8% of white Americans experience food insecurity. And when you compare that to the rate that Black Americans experience this, it's disconcerting, with Black Americans experiencing food insecurity at a rate of 21%. Now, this is the information from last year. This is expected, the number of Americans impacted by food insecurity is expected to spike and is spiking because of the economic impact of the pandemic. And for some perspective on that, in mid-May, over 36 million Americans had filed for unemployment as a result of the pandemic. Now, it's estimated that because of the economic impacts of the pandemic, that over 17 million Americans will be forced into food insecurity. So we're looking at, almost a 50% increase in the number of Americans who are struggling with this public health challenge. Now, how has the government tried to respond to this crisis? Well, the 7 programs that I'm going to look at today and kind of discuss the government's response with regard to are the child nutrition programs. So think of the school lunch and breakfast program. Pandemic EBT. EBT is electronic benefit transfer. SNAP, or the Supplemental Nutrition Assistance Program. WIC, the USDA's Coronavirus Food Assistance Program, the Nutrition Service Program under the Older Americans Act, and the Public Assistance Grant Program out of FEMA. So it's kind of like a survey course, and we'll look at each of these and how they're being adapted to address this increased need resulting from the pandemic. So we'll start looking at the child nutrition programs under the USDA. And we'll give a little background on how these programs function and how many people they impact. So the National School Lunch Program is the more popular of the two between the National School Breakfast and the School Lunch Program, which in and of itself is a bit of an issue. But 30 million students participate in the National School Lunch Program, with 22 million of them receiving free or reduced price meals. And students who are eligible for these, eligibility is based on family income. So these are the kids who are most impacted by food insecurity. And so those numbers are, the 30 million for the school lunch program and the 14.7 million students in the school breakfast program. Those are the numbers that are served during the school year, the students who are involved in those programs during the school year. And we need to look at how these children are served during the summer, because this is critical to what's happening during the pandemic. So when school is closed for the summer, there are two programs that kick in. The Seamless Summer Option, which is a USDA program that allows school food authorities to essentially continue providing school lunch and school breakfast to children using basically the system they use during the school year, and they are reimbursed for the meals they serve at the same rate that they would during the school year. But the Seamless Summer Option is only available to the schools to run a feeding program. The other program, which has a wider reach, is the Summer Food Service Program. And this is a program that's open to schools, public agencies, nonprofits that can operate feeding sites for children during the summer. And this program has a higher reimbursement rate for the participants. Now that program, the Summer Food Service Program, reaches about 2.7 million children during a normal summer. I believe the Seamless Summer Option reaches about 1 million children. And so only about 17% of children who are getting free and reduced meals during the school year are actually being served by these programs during the summer. Now, these programs, the Seamless Summer Option and the Summer Food Service Program, are the programs that schools are using right now to feed school children during the pandemic, because these programs can be activated for unexpected school closures. So right now, all the school feeding operations that you see across the country are functioning under these two programs. Now, these programs have had to be modified to deal with the realities of the pandemic. And to adapt the programs to the pandemic, the USDA has issued waivers for several of the program's key requirements. Now, the first waiver I'll talk about is a nationwide congregate feeding requirement waiver. So normally, in these programs, children need to be fed in a group. Now, with social distancing, that's a problem. So they've issued this nationwide waiver, which originally ran through the end of this month, but has been extended through the end of August. And so this waiver is allowing some of the delivery models we're seeing schools use. You know, the grab and go model, where you may have cars, driving up to the front of the school or to the community center where meals are being prepared, and families are picking up meals there and taking them home. Some schools are doing delivery directly to students' homes. So that waiver was required to facilitate those two models. There was a waiver that I believe has expired at this point. It was the waiver of the meal pattern requirements, and that essentially, think of it as the nutrition standards for these school meals. There was a waiver in case there were shortages of foods as a result of the pandemic. So if they were unable to secure enough whole food grains to incorporate into the school meals, there was this waiver which ended, I believe, at the end of April. The mealtime waiver is another important waiver. Normally, for a school or an organization to be reimbursed for a meal, they have to serve that meal during a certain time window. For example, to have a meal qualify as a lunch, normally it has to be served between 10 a.m. and 2 p.m. But that's been waived until the end of August, and this allows, again, these grab-and-go models, these delivery models that are in place, and it allows, some schools aren't, running a grab-and-go program every day. They may operate it once a week and provide meals for the week. And so this mealtime waiver is allowing programs to adapt to the realities of the pandemic. And then another important one, normally the meals have to be provided directly to eligible children, but the federal government has made available a waiver that would allow parent or guardian to pick up the meal and take it back to their children. Now, while these waivers are important to allow, these programs to adapt to the realities of the pandemic, there's still huge challenges. Number one, transportation. You have a grab-and-go model is excellent, but if a family is unable to get to the pickup location, it makes things very difficult for them. So transportation, especially in rural communities where the distances could be greater between the feeding site, whether it's a community center or school, is a major challenge. And also, schools are losing money through these programs. While they're providing this important service, the costs of running these feeding operations during the pandemic are more expensive than the traditional, models that they use. And when school is open, you have children who participate in the school meal programs who pay full price for their meal. And those children, their full price payments help maintain the nutrition programs at those schools. So with the COVID closure, they've lost that income and they have increased costs. And these costs are exceeding the federal reimbursement for the meals they're serving. So this is a real challenge right now with the program. Now, what are some of the kind of unique solutions that are being developed to try to address some of these? Well, from a transportation point of view, there is an interesting and I think important program called Meals to You. And this is a partnership between the USDA, Baylor University, and McLean Global and PepsiCo. And what this program does is it helps feed low-income kids in rural areas across the country. And what this program does is it mails food to the families. So every 2 weeks, a family that's participating in this program will get 10 breakfasts and 10 lunches for each child who participates in this program. Now, initially, the goal of this program was to feed provide 1 million meals a week, but it's been very successful, and they've been able to increase their capacity with this. And so now they're looking to serve 5 million meals a week to food insecure children in rural communities. Now, the way that children can get access to this is that their school districts need to apply to be part of the program. And to participate in this program, either you can apply at the district level or for specific school. But the metric in terms of getting access to this program is either a school or a school district have 50% of their students qualifying for those free or reduced price meals. And that's kind of used as the kind of financial need metric. And it has to qualify as a rural community under USDA standards. Right now, this program currently runs through the end of this month. I think this is a really important program, and I hope that the federal government looks at expanding this through the actual summer. Now, the reason that Baylor University is involved in this, and is kind of the linchpin in this, is that they had received a USDA grant last year to study the use of mail delivery of meals to children in the summer because of that drop-off I talked about, that only 17% of kids who participate during the school year in the lunch and breakfast programs are getting fed in the summer. So they had already been investigating how to do this, and COVID, really provided the opportunity to amp up this resource to meet the important food needs of rural communities. Now, another intervention that's being utilized that gets to, I think, to the issue of transport is the pandemic EBT program. And this was authorized through the first major relief bill, the Families First Corona Response Act. And what it does is for families whose kids receive free or reduced price meals, it gives them money on electronic benefit transfer card to use in their normal grocery shopping. And states need to apply to the USDA to be able to participate in this program. And it's the state agency that runs SNAP that is the state lead for this, because there are a lot of similarities between this and SNAP. The federal government pays for all of the benefits, all the additional funds that are given to the families of school children, and they split the admin cost of running these programs with the state. Now, in terms of the magnitude of this benefit, states that participate in this program can provide money for each day that school was closed because of the pandemic. So if school's closed on March 15th in your state, and the school year ends June 30th, the state can provide funds, for each day that school was closed, and they can award those funds retroactively. So if a school gets approved on June 14th, they can still provide the full benefit from, March 15th on to the end of June. So there is I think that retroactive component is very important in supporting these families. Now, the benefit has to be issued through an EBT card. So if families are already on SNAP, it can be added to their SNAP card, but families that don't have an EBT card are going to have to be issued one by the state. Now, families that get these additional funds to help with their grocery shopping aren't prevented from participating in the meal programs we talked about earlier, the Seamless Summer option, or the other, food programs. So it doesn't replace that, it supplements those efforts. Now, some of the challenges that the pandemic EBT program has come across is that as of mid-May, only 15% of eligible students were receiving these benefits. And not every state has been approved for the program yet. So as of the end of May, 37 states and DC had been approved. Now, there are challenges in identifying eligible families. Schools are allowed to share their records with the state agency that will be administering this, the agency that runs SNAP. However, there are some issues in terms of the accuracy of these school records in terms of having up-to-date addresses for eligible children. And another one of the issues that's been identified is that states have different, lengths to their school year. They end at different times. So in a state that has a longer school year, there is a potential for a larger benefit because it's based on the number of days that the school has been closed as a result of the pandemic. And at the same time, states are concerned about the administrative costs with running this program. Even with the 50-50 split with the federal government, there's a concern about administrative capacity. And Utah did not apply for pandemic EBT because of their concerns about their administrative capacity. I don't know if that has changed, but it's a barrier. Now, I think this is an important intervention to deal with that issue of transportation, that you're not having to get to a school every day to pick up meals. This is a program that, I think has use beyond just the pandemic, to help feed children during the summer. And there is a program called the Summer EBT program that started within the past decade that was doing something very similar to this, issuing EBT benefits to supplement the food purchasing power of families who had children who relied on these school nutrition programs. Now, that program is still active, but only in 2 states and with 2 tribal governments here in the country. So I think there's a potential to expand this type of tool outside of the pandemic. Now, the Supplemental Nutrition Assistance Program. This is the largest nutrition program in the country. And prior to the pandemic, it was serving about 38 million Americans. And, to qualify for this program, there are income restrictions. The benefits, this provides money for grocery shopping, and it's issued through an electronic benefits transfer card. And the amount of money that's issued to a family varies based on the size of the family and the income of the family. Now, there are some work requirements to this program, and I mention these key background issues because they've come up in the government's response to the pandemic. But before I go into the government's kind of modifications to the program, I think it's important to note that SNAP has been proven to be an excellent tool for economic stimulus because this is money that is spent right away in local communities. And studies by the Department of Agriculture and other organizations show that for every additional dollar of SNAP benefits that are issued, it translates into an additional $1.50 to $1.80 in economic activity in the community. So a little background on the program, but how is SNAP being modified to try to address the increased food security needs? And there are a couple key things that I want to point out. There's this concept or a tool of emergency allotment that states can provide the maximum benefit for a household of their size during the pandemic. So normally it's a range, from a minimum, benefit that is, a few dollars to, hundreds of dollars, depending on income and size of the family. What the emergency allotment waiver means is that, regardless of income, if you have qualified for SNAP, you can get the maximum allotment or benefit available for a family of your size. So, for example, The maximum allotment for a family of 3 is $551. So that's a way to get more money into the hands of SNAP families who are impacted by the pandemic. Now, I mentioned work requirements earlier because during the pandemic, we have this system-wide shutdown of the economy. And, we had, well, I can't even remember my own statistic, over 30 million individuals have applied for unemployment benefits. So having a work requirement to access these benefits is ludicrous during the pandemic. And so the federal government has waived one of the work requirements. The work requirement that's referred to as the able-bodied adult without dependent work requirement or time limit. And so individuals between 18 and 49 who are able to work and don't have dependents, whether children or they're caring for an elderly family member, are subject to an 80-hour a month work requirement. Those hours can be met in a few different ways. And if they don't meet this requirement, they can only get 3 months of SNAP over a 3-year period. So the federal government has waived that and said that, from April 1st till 1 month after the termination of the public health emergency, states cannot deny individuals benefits because they failed to meet this ABOD requirement. And I think this is a critical, modification to the program. Now, there are also waivers. There are a lot of things that have traditionally been done in person, like interview requirements, recertification meetings for the benefits. Those have been waived, obviously, for social distancing needs. Now, another large nutrition program is the WIC program, and this is a program that serves low-income pregnant and postpartum women, infants and children under the age of 5 who are at nutritional risk. And in this program, they're provided certain healthy foods to supplement their dietary needs. So we're looking at things like milk, fruit, vegetables, infant formula. So there are specific foods that can be purchased either with paper coupons or WIC EBT. All states are required to transfer over to kind of that debit card model for the WIC program by this October. Now, this program serves approximately 6 million people prior to the pandemic. And this program, and I'm going to mention this, because it's relevant to the waivers that are in place, there are clinical visits that are required for this program. And states that, are required to have at least 2 clinic visits a year. Usually it is the application and then health assessment meetings. And so, there's some key things that have happened to continue to allow this program to help folks, but deal with the realities of the pandemic. First of all, this is a block grant program, and so additional funds have been allocated to WIC, with $500 million being made available for the program, an additional $500 million being made available through the end of September of 2021 to deal with, to help increase participation in the program. The physical presence, there are physical presence waivers in place so that individuals don't need to come in to deal with some of, the enrollment, and they're allowing deferrals of the nutritional assessment. They're allowing for remote benefit issuance so that, individuals don't need to come into the WIC clinic to get their paper coupons or to have funds placed on their WIC EBT card. And there were, initially there was a fear that there would be shortages of some of the WIC required foods. And so there was a waiver that allowed substitution of some of those required foods. And, the idea wasn't that, you could use your funds identified for, a carton of eggs to buy Doritos or chips. These waivers were often different size containers of the same product. So if it wasn't a container of 12 eggs, you could get a container of 18 eggs, So there was this kind of waiver to try, deal with some of those initial concerns that there might be shortages of WIC-prescribed food. Now, this is a story that folks have probably seen in the paper, that our nation's food banks are absolutely slammed during the pandemic, with people losing their jobs and increased food insecurity. Feeding America has reported that 98% of food banks are increasing a demand for food assistance, and almost 60% of them have less inventory than they normally do. So they're struggling to get food to meet this increased demand. And part of the reason they're struggling to meet this demand is because a lot of the organizations that traditionally donated to food banks are being impacted by the pandemic. So grocery stores, traditionally a source of donations for food banks, they have been, struggling to meet the demand of their retail customers, so they don't have the surplus to donate to food banks. The closures of schools, universities, restaurants, food banks are losing out on donations from these institutions as well. When you have food banks struggling to feed folks, and you see the stories about farmers are being forced to dispose of food, there are stories of millions of gallons of milk being disposed of produce being tilled back into the soil. This is happening because we essentially have two major food supply chains. We have the retail food supply chain that, deals with grocery stores and the like, and we have kind of a commercial food supply chain that provides food to restaurants, universities, hotels, and that commercial food chain, with all the closures, farmers are suddenly without customers to buy their food, and it's difficult for them to transition over into the retail food supply chain, and the retail food supply chain can't absorb all the excess food. So farmers are being forced to dispose of that food. And so this is this shocking story we're seeing repeat across the country. Well, the USDA created a new program called the Coronavirus Food Assistance Program. And what this does is it's allocated $3 billion for the purchase of fresh produce, dairy, and meat. And these foods are going to be used to create 5 different types of food boxes: produce boxes, dairy boxes, meat, fluid milk, and kind of a mixed product box. And these boxes will be distributed to food banks and other nonprofits that are working to fight food insecurity. So that is the federal government putting money in place to purchase that food that would otherwise go to waste and trying to connect it to the food banks that need it. And to date, about $1.2 million has been spent. And right now, the program is running between May 15th and the end of this month. Now, USDA may expand this program through 2-month options. So if the USDA thinks this has been a successful program and should continue, they have the option of extending it to the end of August and spending more of that money to continue to purchase this food to connect it to food banks. Now, the way this is being run basically is that the USDA is awarding contracts to organizations that will serve as kind of the general contractor or the distributor in the program. And what they do, the contract awardees are responsible for connecting with farmers and purchasing the food, having it packaged, and then having that food delivered to the food banks around the country. Now, there have been some challenges with this program. There's been some news coverage of the hurdles that this program is trying to get past. And part of the challenge is, I think, tied to how quickly the USDA wanted to get this program up and running. You know, I think this is an important program, but the USDA, I believe, reviewed over 1,600 applications from kind of the distributors who would be, you know, receiving the funds and putting the programs in place. And they awarded, I believe, 198 contracts within 1 week. And it's a pretty fast turnaround for a lot of contracts. And they're finding now that some of the organizations that have been awarded contracts don't have the capabilities to function in a way that, you know, ensures that the food is getting to the people in need. And so there have been news stories questioning some of the contracts that have been awarded. And they pointed out that, you know, there are key organizations that work in hunger relief year-round who did not receive contracts, and there are the largest food distributors in the country who have, you know, the infrastructure and logistics to easily provide this service were not awarded. So companies like USA Food were not awarded these contracts. But I think it's an important program that is trying to connect the supply and demand during the COVID crisis. Oh my gosh. Not sure what's happened here with this slide. All of my text is not there, but my old man memory is not too bad today. But what I have here is a discussion of the Older Americans Act Nutrition Service Programs. And this is a program that is running year-round that provides funds to feed senior citizens, either in a congregate setting, like a community center, or to fund meal delivery programs for seniors who are unable to leave their home. And this program, you know, the goal of this program is to, you know, one, to address food insecurity in seniors and to promote socialization and mental health well-being in this population. Okay. Now, normally, this program is funded at $776 million to provide these meals, you know, with the larger portion of funds going to congregate nutrition programs. Now, states have to provide a match to get these funds from the federal government. They have to provide a 15% match if they want access to these home delivery and congregate nutrition funds. Now, under the federal government's allotment process for this is they look at the total U.S. population over 60 in each of the states. So you have this set formula for determining the state benefit, but then the state needs to put some funding in there as well. So what is happening during the pandemic with this important program? And unfortunately, and I'm going back to this slide, some of the information that, for whatever reason, isn't showing up is that the majority of folks who participate in these programs, the seniors who participate in these programs account for more than 50% of their food intake on any given day. So these are absolutely critical programs for the individuals who participate in them. So I just want to emphasize that. Now, what has happened in response to the pandemic? Well, there's been a huge infusion of funds into the program. through the Family First Corona Response Act and the CARES Act, an additional $720 million have been allocated for these nutrition programs for seniors. So it's almost a doubling of their 2020 budget. And there's been additional flexibility. Now, they're allowing states to transfer any of the funds that they had for the congregate feeding programs to the home delivery programs because of the issue of social distancing. They're also allowing any individual who is stuck at home for social distancing can receive meal delivery regardless of the state's current policy, for qualifying for home meal delivery. And the federal government has also waived the state match for these additional funds. So it's an important program that is delivering food to at-risk seniors during the COVID crisis. And this is the last program I'll talk about. And I think this is an interesting use of a program that's not traditionally seen as a food insecurity intervention. So we're looking at FEMA, and the largest grant program that FEMA administers is the Public Assistance Grant Program. And these funds are traditionally used for emergency work or what's referred to as permanent work. And so you have funds that are allocated for the removal of debris after an emergency, or paying for emergency protective measures after an emergency. And the permanent work could be things like rebuilding roads, repairing public utilities, restoring damaged buildings and equipment. But these funds, this grant program, is triggered by the president's declaration of an emergency, and states have to put in a request to get access to these grant funds. And there is a cost sharing in this grant program that states need to provide to get access to the grant. Now, the change that occurred during the pandemic is that the federal government, FEMA issued a policy update that said that these funds could be used for purchasing and distributing food to vulnerable populations as an emergency protective measure. And they emphasize in this policy update, a focus on individuals over the age of 65 and providing service to folks with serious health conditions. And so what we've seen, and this is the first program of its kind in the country, and it's the only one that I've seen, is that California immediately applied for one of these public assistance grants to run a program in their state. And so what their program does, and it's called the Great Plates Delivered, is it tries to address two issues at the same time. It's trying to deliver meals to senior citizens and individuals who are at risk, who need to socially distance, but using the restaurant industry, so that restaurants that have taken, this big economic hit with the pandemic shutdown are now being, through this program, converted to kitchens to feed senior citizens, and those meals are being delivered to individuals. So it's this, I think, an interesting use of this FEMA program to address the issue of food insecurity in seniors, address social distancing, and help an industry that has been hit by the pandemic. And there still is, a federal cost share related to this. But in California, you have the local government have to choose to run this program, and they fund the program but are reimbursed for their costs out of the FEMA grant and state funds, so that the vast majority of their costs are reimbursed, and I think around 6.25% of their costs are actually borne by the local government. And this is an optional program out in California. But I think this is an interesting example of using an existing program in a new and unique way to try to address this problem of food insecurity. And this is, as I said, the last program I'm going to talk about. I think these are all important tools in dealing with the overwhelming need that we have right now in this country. I think there's still more that needs to be done. There are a lot of folks who are in need, and it's going to take the efforts not just of the federal government, but of all levels of government and the private sector to really help those in need. Thank you very much for your time, and I'm happy to answer any questions.
All right, thank you, Matthew. Excellent presentation. We have our first question. We have a summer meals program about to start for the 6th year. This year will look incredibly different due to COVID. We are looking for best practices around food prep and food delivery.
Okay. I have some resources that I'm going to put out there. Other organizations that I think have the expertise and have already developed resources and toolkits that will be incredibly useful for the unique challenges that the pandemic is creating for the summer nutrition program. The first organization that I'm going to mention is No Kid Hungry. This is a tremendous organization that really focuses on child food insecurity, and they have created a toolkit for school nutrition programs called Emerging Strategies and Tactics for Meal Service During School Closures Related to Coronavirus. So I think they're going to have going to be a great resource for best practices in terms of meal prep and distribution. Again, that organization is No Kid Hungry. They have an amazing website. Maybe we can post some links along with the slides for folks who are interested in that. But there are two other organizations that also probably have some good tools. Surprise, surprise, the FDA has some resources about general food safety during the pandemic. So there's some resources there. They're not directly targeted at schools, but I think some of the food safety measures discussed with regards to the restaurant industry and other aspects of the food service sector are applicable to school operations. And you also have the School Nutrition Association, which I know has been doing webinars on food safety for school nutrition programs. So I think those are three great resources. Again, No Kid Hungry, and I'm going to give them a big plug. That would be the first organization I look at. The FDA and the School Nutrition Association, which is kind of a professional organization for school nutrition professionals. So hopefully that's helpful. Again, No Kid Hungry, I think that is a great resource for people to check out.
Would there be a logistical benefit to federalizing the National Guard to support the food transport system in support of food banks?
Okay, this is a good question. First of all, the National Guard has already been mobilized to help food banks in many states. So you have guardsmen and already packaging food, distributing food, assisting with the logistics of food bank operations. So you already have that happening. But there's the issue that, there's a key term in there, and it's the federalizing of the National Guard. And there are three ways that the National Guard can be activated. There can be a state activation where the governor of the state activates the state's National Guard to provide services to food banks to help out, and the state has to pick up the bill for the cost of activating the National Guard. When you say federalize the National Guard, it's, to be technical, it's activating them under Title 10. And what that does is it puts the National Guard under control of the federal government. And the federal government has to pay all the costs associated with the activation. And I don't think that's helpful. I don't think that's helpful, and I'll tell you why. I used to work in emergency services through the American Red Cross, and I've also worked in emergency services for the Baltimore City Health Department. And for folks who work in emergency services, there is a saying, all emergencies are local, because that is where the boots on the ground are. That is where the knowledge of the community is and the needs of the community. And so I think state and local government are in a better position to assess the needs of their communities during the pandemic and how best to direct the resources. So I don't think putting them all under federal control is the most effective way, because I think local control, the local control is going to be key in responding to this. But what the federal government can do is, I said there were 3 ways to activate the National Guard. The third way is under a Title, I believe, 32 activation. And what this does is, when it activates the Guard, the governor in the state still has, command over the National Guard, but the federal government picks up the cost of activating the Guard. And states, may be hesitant to activate the National Guard to help with, operations like food banks because of the cost. And if they did this Title 32 activation, you can activate, have local control to address local needs, and still get the support of the federal government through this activation. I know several states have already done Title 32 activations. I know California has done that, Washington State has done that, and New York has done that. And traditionally, there's a cost share under this, like a 75% federal, 25% state. But I know the federal government has waived the cost share for at least those 3 states during the pandemic. So I think it's important to acknowledge that the National Guard is a potential resource for food banks and other food security operations. They have logistical expertise. They're being used already for important functions, setting up testing sites, running testing sites. I think it's important to acknowledge that, but I don't think having the federal government control all of the operations is the best way to go. I think, potentially this Title 32 is a way to maintain local control and get the financial assistance of the federal government. I think that's the most I've ever talked about the National Guard, but that's my answer.
Are there allowances in any of the meal programs for delivery? We are finding many without transportation that have lost jobs and are without resources.
Yeah, this is a critical issue. The kind of the logistical issue of getting the food to the folks in need. Some of the programs we discussed have a delivery component to them. Some of the schools are able to deliver meals. I don't know how they are funding that delivery. I haven't researched that. That Meals to You program through Baylor University, that partnership, utilizing the mail system. The Older Americans Act is using delivery. But where I think the biggest challenge is, and where there is a gap, a serious gap, is the SNAP program. There are not resources allocated to the SNAP program for meal delivery. So, and this is something I'm going to talk about a little bit. So, until recently, you could not use your SNAP benefits online. So if you didn't have a grocery store in your community, you couldn't purchase groceries online like like a large portion of the population is doing right now during COVID. But the 2014 Farm Bill allowed for a pilot program to see how we could run a program that would allow SNAP benefits to be used online. And that pilot program didn't get stood off until April of last year. And it was only in a few states, and there were only a few retailers participating in the program. I think in most states it was Amazon and Walmart, really big retail chains. And I think part of it is because you have with big retailers involved, because there is a technology challenge that I won't get into because it will probably put folks to sleep. But part of the rollout, the pilot program was to figure out the technological aspect of online SNAP. COVID happened, and there has been a massive expansion of states going to online SNAP. I believe there are 35 states now that are currently operating online SNAP, and maybe 3 or 4 states that are in the process of applying to run an online SNAP program. Now, the aspect of delivery, there's 2 elements to that. Will the participating retailers provide a delivery service? I've read that some of the retailers will, and some will require, curbside pickup and won't do delivery. I know that Amazon offers a discounted Prime membership, and I'm sorry, this sounds like a corporate plug, but since this is a partnership between the public and private sector, Amazon has offered a discounted Prime membership to folks on Medicaid or on any of the, on WIC or SNAP. So for like $5, $6 a month, they can have a Prime membership that allows free delivery. They'll get free delivery of their purchases, so their grocery purchases. So, you've got that kind of retailer aspect of this. But from the programmatic standpoint, from the government standpoint, the federal government prohibits any of the SNAP funding from being used to cover delivery costs. So if someone on the SNAP program wants to use their benefits online and there's a delivery charge, they need to pay for that with a separate income source. That is an obstacle to making, the kind of online SNAP more effective. I think, there has to be a way to get these delivery services covered by SNAP. It's, I think, critical during the pandemic for folks when we're worried about social distancing. But beyond the pandemic, the issue of communities with low, food access that don't have grocery stores, this is, or folks who normally have issues with mobility and can't make it out to, a grocery store or corner store. I think developing the SNAP program in that way could be incredibly helpful to meeting the needs of folks. So I think delivery is a big challenge. I really hope that, programs continue to look at that obstacle. So I think it's really important.
Thank you, Matthew. And with that, we're actually at time here, so I'm going to hand it off to Charles for closing remarks.
Thanks, Kayleen, and thank you again, Matt, for presenting today. I learned a lot, and I know our attendees did as well. So just a few final notes to everyone. If you submitted a question that did not get addressed during the Q&A session, don't worry. We'll be reaching out to you via email to make sure your questions get answered. Also, all attendees will be receiving an email from the network with a video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out, and it provides us with some great insights, especially in regards to what topics you might be interested in for future webinars. You'll also be receiving an email from ASL and me with information on how to apply for CLE credits for this event. Join us next Thursday for the first of a 3-part webinar series on COVID-19 and human rights, where our presenter will focus on public and global health law and ethics in response to the COVID-19 pandemic, including balancing public health with human rights. Learn more about that webinar and view the network's collection of resources on the pandemic at networkforphl.org/COVID-19. That concludes today's webinar. Thank you all for attending and have a great rest of your day.